We were wined and dined by pharmaceutical companies in our office, the Similac, the Enfamil companies, formula companies. And they wined and dined the hospitals too. And the hospitals on their postpartum orders had a standing box that you could check for something called del-estrogen or deladumone, which was an injectable medicine that would dry up breast milk so that a woman wouldn't get engorged. And we encouraged bottle feeding, giving women injections of hormone to dry up their breast milk so they could bottle feed with formula. This was the standard in those days, and we just did that, and we just followed along. That's what we did in the early 80s. And so we thought that that was normal because everybody was doing it. And the hospital told us it was a good idea. And the big pharma told us it was a great idea, that it was more convenient. You could go back to work sooner. You wouldn't have they gave you all the reasons that are wrong, but they gave you all the reasons to think that this was a good idea. So that's what they did, Polly.
Did you have informed consent of what was happening?
Of course not, because we weren't informed. Even we, the doctors, were not informed of the benefits of breast milk. And you're going to fall over when I tell you this. In medical school and residency, we didn't have a single day or lecture on nutrition or breastfeeding in 8 years. We didn't have lectures on wellness, nature's design, the whole process of mammalian birth. They didn't teach us that. We had lectures on pathology. So we learned what we learned. And the problem, of course, now is that you can't get out and practice anymore either, because you go through all that training and then you come out and you get a job working for a big HMO or a big university corporation, and they tell you what you can prescribe. They tell you how much time you have for each patient. They set your schedule. They tell you what surgeries that you can do, what surgeries you can't do, what drugs you can use, what drugs you can't use. So it's almost as if we're just bots. We're trained as bots, and we're not trained to think outside the box. If you do something that's in honoring your patient's desires, then you might get fired from your job. We saw this happen with the vaccine. You get vaccinated or you're fired. So that was the same sort of thing. Sometimes it's subtle and sometimes it's overt. But subtle coercion is still coercion. And coercion, according to every tenet of medical ethics in medicine, is never permissible. And yet coercion is used every single day in every doctor's office and every hospital, whether it's intentional or not. We're not being honest. You can't possibly give true informed consent to anybody because the medical model doesn't allow the time for that. You can't give somebody informed consent in 8 minutes if you have a prenatal visit that's 8 minutes long.